Welcome this Sunday morning to our PABR Method Wellness Group and our Wellness Hour with Dr. Kimberlyn Mizera. Dr. Kimberlyn Mizera joins us today. She's also from Victus Integrative. We interviewed her husband last week on some different topics, and Dr. Mizera has a specialization and interest in topics a little bit different from her husband, and so I wanted to bring her in today to talk to us about nutrition and vitamins and IV therapy. So there's a lot of different questions surrounding this type of healthcare, and what better to bring in a naturopathic physician, Dr. Mizera. She studied nutrition, exercise, and wellness at Arizona State University before going on to get her doctorate at the in naturopathic medicine at the Southwest College of Naturopathic Medicine. She has a variety of interests, and I can't wait to have this discussion with her and to have you guys all hear about just some different topics related to vitamins and how we can actually improve our health through the use of vitamins or IV therapy. So thank you, Dr. Mizera, for coming and joining us today. If you want to share with us a little bit more about your background, I'd love to hear a little bit more, and then we can dive in.
Yeah, thank you, Dr. Amy. Thank you so much for having me on this morning. And doing this on a Sunday to make it work with my schedule. I appreciate that too, taking up your Sunday morning. So my background, I work at Victus Integrative Medicine, my husband, Dr. Robert, as well. And what we really love to focus and work with is the metabolic health patient. So like last week, you guys were talking about lipids and diabetes. Hormones play a really big role in that too, to optimize how you regulate your blood sugar, what your lipids look like. So we kind of each took that to heart as well. He focuses more on the men's health, and I took the women's health side. And with that, that includes all of the female hormones, but then also thyroid. I work a lot with insulin regulation, things like that as well. So it all goes together to play and synergistically in your body.
That's wonderful. And now, alongside that, you're also a clinical director at an IV nutrition clinic in the Scottsdale area. That's correct?
I am. Yeah, I
Wonderful.
really enjoy working with IV therapy. It's a great way to optimize nutritional levels in the body, which again plays into so many other things, which we will go into today, but that plays into your hormone levels, making sure you have optimal nutrients to regulate and balance your hormones and blood sugar and stress and so many things.
Yeah, well, that's wonderful. I'm really excited to dive into this. Now, there's a lot of talk out there about vitamins. We hear all the time that yes, obviously you want vitamins to come from food, but there's always this talk about whether or not you should take them with supplements or not. So can we just touch base on just vitamins in general? Is it important to take supplements or other forms of that? What do you learn? What do you educate your patients on?
Yeah, absolutely. So we always advocate for healthy lifestyle. So a good nutritional foundation is always key. Exercise, movement, those things aren't really replaceable with a supplement. You need to still have that foundation. With the IV therapy and supplementation in general, whether it's oral or IV, there's certain nutrients that we just don't get a whole lot of. And humans are actually unique in the sense that most mammals and animals in general can synthesize their own vitamin C, for example. Humans are among the few that cannot. So that's an essential nutrient that we need to get outside of what our body is making on its own. So we could get that through diet. We could get that through supplementation. IV therapy and vitamin C is actually really unique in that sense that we can get higher levels through IV than we ever could orally. So that's just one example as far as why supplementation is so important when it comes to specific nutrients.
Okay. So now what are all the different vitamins that you can do through IV therapy? Are there certain ones or all of them? So
at IV nutrition, where I work, we focus on nutrient supplementation. So we focus on vitamin C, getting all of your B vitamins. We have all of the minerals, selenium, zinc, magnesium, potassium, chromium. There's a lot of trace minerals in there as well. And then we have a lot of different amino acids, and amino acids are just as important, those building blocks to proteins. We have all of the essential amino acids, and then we also focus on specific ones depending on somebody's need. So we can focus on lysine supplementation, glycine, proline, tryptophan, things that help with one, hormone regulation. It could focus on your collagen production, tissue healing. It could focus on the anxiolytic properties. So decreasing somebody's anxiety is really useful with the IV therapy.
So are there specific vitamins deficiencies that you see that go along with higher levels of anxiety? Is there a common thread, or is it dependent on the person?
Everybody's going to process anxiety in different situations differently. So with vitamin, again, going back to vitamin C, is actually really useful for times of stress. Again, because we don't make it ourselves, we have to get it externally. When we're stressed, we actually use up more of the nutrients, vitamin C included, but B vitamins are really important for your stress response as well. Magnesium is just really calming. Your adrenals actually have the highest concentration of vitamin C in the body, so it actually is used to produce those catecholamines, the epinephrine, your fight or flight response. So you use up these nutrients in times of stress, and you need to supplement that back in so that the rest of your body can have those nutrients to work with, and that we can get back to normalizing and optimizing just overall well-being. So when people come in for stress, we do focus on the tryptophan, the glycine, those anxiolytic aminos, but then also replenishing the nutrients that got burned up.
Got it.
If that makes sense.
Mm-hmm. It's like what we take in for food can kind of be used for normal daily life, but then when you're at a heightened stress level, it's good to have that supplementation because you need that boost just to be able to handle all your fight or flight responses. Is that about right?
Right,
Wow.
absolutely. And there's a huge difference between RDI and optimization. There's all this space in between. RDI, your recommended daily intake, is what do you need to have as far as your dietary intake? What do you need to be getting every day to prevent disease? So to prevent scurvy, to prevent this or that, or B vitamin deficiencies lead to a skew of different things. So it's not just so much in decreasing or preventing those outright deficiencies. It's how do we optimize the body to function at its best, which is where taking care of anxiety comes in, because there's so much room between those that everybody responds differently. And that's the really great thing about nutrition versus using a prescription medication. Everybody responds more or less the same, but different, if that makes sense. It's not a medication turning something off or on 100% of the time. It's your body's going to use this in the way that it needs to use it right now.
Right. And I know a lot of professional athletes get the IV therapy because they're at the higher level. Of course, we know when you're at a high physical performance, you're in a fight or flight mode for a long period of time. They don't get a lot of rest in between, whatever professional sport activity they're doing. So I can imagine after hearing this, that is also part of why they're getting that on a regular basis, just to help their body be able to handle the stresses in a nice way. Okay.
Yeah, we actually have a lot of athletes that come in for IV therapy, and it's to decrease that oxidative stress from increasing your metabolism. You're going to increase a lot of different free radicals. You're upregulating your metabolism and all these different processes in your body, and having those antioxidants just helps them recover even faster, able to get back into the game and do it all over again.
Wonderful. So now, when we eat, and we always encourage healthy eating, I'm plant-based. I know a lot of people aren't, but I know there is more of a push to eating more plants because you get a lot of nutrients in your plants. But what's the difference between just getting nutrients from your plants versus a pill, like a pill that you take, versus the IV? And why would you consider IV therapy if you're just eating all plants and nutrients? Like, can you explain that for us?
Yeah, absolutely. There's kind of a tier if you think about it in that way. So again, dietary intake is going to be your baseline. Like you need to have really good nutrition that has to be on point if you want to feel your best. There are things in food that we can't get through IV therapy. So fiber, you can't get fiber through an IV line. You need to be eating that fiber and help nourish your healthy gut flora, which again leads into a lot of other different things. That leads into your neurotransmitter production, that leads into hormones, that leads into a lot of other things. So nutrition is never downplayed. Even at our IV clinic, nutrition has to be on point. There's a lot of downfalls with that too. Just for in the past few decades, there's been a decline in the nutrient profile of the soil. So we're not getting as many nutrients in our soil. We're not getting as many nutrients out of our food that we may have in the past. So that's one downfall of relying solely on nutrition, dietary intake. The other is not everybody is functioning at 100% gut health. That's actually very rare to find these days because of the absorbent amount of sugar that everybody's eating, because of the antibiotics that we rely on, because of the antibiotics in our food and preservatives. So nutrition, absorption of the nutrients from the food that we take in isn't always 100%, which you may be thinking that you're getting X amount of vitamin C from your bell pepper or your orange, where in reality, you're absorbing 50% of that. So then the next level would be oral supplementation, so capsules, powders, liquids, things like that that we're adding to our daily regimen. And that's really important too, because you can't get an IV every day. So that oral supplementation, the supplements that you're buying from a very reputable source is also really important, making sure you're getting the right form of a nutrient, but then also a really good source of that nutrient, and that's sourced properly. So even that is not 100%. So you read the nutrition label on the back and it says you have this many IUs or this percent of daily value intake. That doesn't mean you're absorbing that. That doesn't mean it's getting to your cells. So taking that every day is really important because, again, you're keeping on top of it. The IV therapy comes in once to twice a month is what we recommend for just general optimal health in an otherwise healthy person. If you're really focusing on treating something or trying to get a specific outcome, you can absolutely do it more than once a week. You could go up to twice a week if you really wanted to, but once to twice a month is what we generally recommend. And that is just kind of like your insurance that you're for sure getting 100% absorption of this every single time. You're bathing your cells in these nutrients that creates a higher gradient outside that pushes them inside the cell. So you're actually upregulating your cellular absorption of these nutrients through IV therapy. So having each layer just on point and having that down is going to all add up to better health.
Okay. Oh, that's powerful. Now I want to ask you a little bit about sugar. You had mentioned that, is it sugar prevents absorption, or is it that we're just eating a lot of sugar, so we're not eating the other foods that give us nutrients? I'm curious for both.
Both, actually.
Okay.
Yeah, good question.
Yeah.
So if you're eating a food that's high in sugar, it's highly processed, there's probably not a lot of nutrients in that. And that kind of plays into what we call the standard American diet, where we prioritize all these highly refined carbohydrate foods. They're nutrient depleted. You go to McDonald's and you get a Big Mac. Most people are going to say no tomato, no lettuce. So there's no vegetable, there's no nutrients in that other than like your iron from your meat maybe, and then you get all your fortified vitamins in the wheat. But again, that's just, and then all the other sugar. So then you have your soda and everything with that as well. That's incredibly inflammatory, and that inflammation in the gut actually inhibits the absorption. Okay. And that leads to things that most people have heard as leaky gut, which we call intestinal permeability. So there's a lot of consequences to eating too much sugar, the effect that sugar is having on your gut. But then because those sugars that are because of those foods that are high in sugar are nutrient depleted as themselves. Right. So
Now, when you have something like a fruit or a vegetable, which a lot of people loop that into carbs and say carbs are bad, but they loop that in, but with the fiber effect, that the sugar that you have in a fruit or vegetable, the fiber helps go to a different metabolic pathway. Is that correct?
So the thing with fruit and vegetables is, yes, exactly. You have fiber. So you're slowing down that hit to your system, that spike in blood glucose. It's not going to be as immediate as gulping down your soda. So having that fiber slows the absorption, but then that also, the more fiber you have, the less you're going to absorb as your total carbohydrates. So fiber is not counted in your total net carbs. So the more fiber, the better. It's not going to affect your blood sugar as quickly, as hard, as intense. And when it comes to fruits, I don't like to have people limit and think too much about, can I have this fruit? Can I have this vegetable? The more important thing is, are you eating fruits and vegetables versus grabbing a cookie? If you were going to grab a banana over a cookie, I'd be really happy about that, even though bananas are higher in sugar. And really, that really comes down to when I'm working with patients that are diabetic, we do focus more on the berries because those are going to have the most antioxidants, which are protective to your nerves, to your blood vessels, and decreasing inflammation. But then the fiber, so then your sugar isn't hitting your system so hard.
Okay. And then this may or may not be your specialty, but in terms of organic food versus non-organic food, do you recommend that people eat organic for things that don't have a harder shell, or do you like a banana or a pineapple has, a thicker covering that we typically don't eat? So do you recommend organic for all types of fruits and vegetables, or only ones that don't have that outer covering?
Yeah, good question. So I actually hand out a list of the Dirty Dozen to every patient that I give the dietary handout to. Has it on the first page. Like, if you're going to buy or you get organic, which it's not a reality for everybody that they can afford to buy organic everything. I don't even buy organic everything. Sometimes it's 10 times the cost to buy one version of like an organic bell pepper, for example. They're always like 50 cents for the non-organic, and it's $3 a piece for the organic. So again, it comes down to, I'd rather you be eating vegetables. Obviously, organic is going to be better when possible. And if you have that budget to work with that, if you are prioritizing organic in your life, that's awesome. But again, if you're going to be going for a handful of berries over a highly processed cake or cookie, it's not so much, is it organic or not? It's, are you making the right food choices? But I do absolutely try and encourage all my patients to buy organic versions of the Dirty Dozen, because those are the best bang for your buck.
Right. And part of my understanding is with food that's non-organic, it's the addition of less nutrients, but also chemicals. Is that correct? Like the two things, it's like you're getting hit from both sides, right?
You are. Yeah, absolutely. And if I buy non-organic, for me personally, I'm always peeling it. I'm never eating that outer layer that's directly in contact with those pesticides. So cucumber, again, bought it for 25 cents the other day. I'm not going to spend $1.50 when it's 25 cents. So you have to weigh those, and I always peel my cucumber anyway. So I figured, what the heck.
Yeah. No, I totally get that. And then also along with this is there are certain vitamins in food that when you eat it with another food that has that vitamin, or like kind of vitamin pairings, there's a couple common ones out there.
There are.
Like vitamin C, right? That has a coupling with, I believe it's iron.
Yeah, absolutely. Okay. So iron supplementation, whenever, for me personally, I would never give iron without those cofactors, because that just enhances the absorption. It enhances how it's going to work. So vitamin C actually does enhance iron absorption. There are B vitamins that also enhance that absorption rate of the iron. I actually have kind of a cool story. I can kind of speak to that. So I had been taking iron supplementation for years, and even while taking iron, my ferritin, my iron stores, was going down. I was like, what is going on? So I started adding liquid iron and adding in all those cofactors. Like, okay, now it's stable, but I'm still not getting my levels up. Like, what is going on? And it wasn't until I got IV vitamin C with B vitamins. There were a lot of other things in there. My iron levels shot up. I was ready to go get an iron IV.
Wow.
But after doing that IVC, my levels shot up so much that I'm not even a candidate for IV iron anymore. So even oral supplementation can be enhanced by certain IV nutrients.
Okay.
So again, it all works synergistically. Everything comes together to enhance your body's optimal performance.
And then another common one that I've heard of is vitamin D and calcium. Is that correct?
Yes. So
Those
vitamin D is actually, vitamin D is actually necessary for the absorption of calcium.
Okay.
And vitamin D is very unique as a vitamin because it's not actually a vitamin. It's actually a hormone. Your body produces it in the sun. And a lot of people, especially here in Arizona, think, oh, I live in Arizona. It's always sunny. I'm not deficient. That's not true because we're always putting sunscreen on. We're always wearing clothes when we're out in the sun. Unless you're going out in a bikini every single day for 15 minutes, you're probably not getting the optimal vitamin D production that you could be getting. So a lot of people are deficient in vitamin D, which a deficiency of vitamin D is just as bad or as negative as too much vitamin D. So I'm a huge proponent of testing for vitamin D on everybody. Because again, too much vitamin D can start having the opposite effect and leaching that calcium and have that effect on your bones that we just don't want.
Wonderful. And then for testing for vitamin D, how is that done? Is that a blood test?
It's just a blood test. Yeah, simple, easy blood test. 1 tube. It's not too bad.
Okay, so that's an easy one. And do you test for other vitamin levels in people on a regular basis?
Yeah, absolutely. So I test iron, ferritin, the storage form of iron, on all of my female patients of reproductive age, because again, every month you're at an increased risk of iron deficiency. So that's one nutrient that I always test for, or blood marker that I always test for, is for your iron. B vitamins are a little trickier. So you can't just test for vitamin B12 in your blood. You have to go for those other metabolites of vitamin B12, because if you're testing your serum levels, that's not necessarily what's always in your bloodstream or in your cells. That's what did you just eat that's in your serum that's boosting that up right now. So a lot of people, when you test B12, it'll be like 1200 plus. That's not always, some people will see that and be like, oh, you have way too much B12, and that's just not true. That's asking something different. So we run other things like homocysteine levels, MMA, things like that. So there's other roundabout ways to test for nutrient deficiencies than the direct nutrient itself. But there's also really large panels. So at IV Nutrition, we actually have micronutrient testing, and we test for, I don't know the exact number, but it's between 30 and 40 nutrients. And it tells you down to your vitamin C, your omega levels, all of your vitamin C, Bs, all of your micronutrients that we supplement with, as well as amino acids. So it's, again, not just looking at the serum, but isolating your cell and seeing how much of each nutrient is actually in your cell, because that's really where the optimization comes. It's not what's in your bloodstream. What are your cells using, rather?
Interesting. And so that can also give you, if someone's coming to you and they're not feeling well, that can help you start to piece apart what possibly is going on, because you're looking at their nutrient profile, and there are certain nutrients that can tell you things about it. So like energy is often coupled with vitamin D and vitamin B12, right? And so it kind of helps put together the puzzle of a person when they're not feeling well, or if they have certain symptoms. That
absolutely, yeah. And every time we do a micronutrient panel at the IV clinic, we make a customized bag to you. So what are you deficient in? This IV bag is tailored towards replenishing those levels.
That's wonderful. I was going to actually ask you about that. So how often, like let's say someone's coming in for an IV twice a month. Do you do blood work, once a quarter, and then you have a program for them for the next 3 months? Or how does that work?
Yes and no. So it depends on the nutrient. Vitamin D, we initially test, and not everybody does test there. That's why we have very, very strict limitations on how much vitamin D we'll give to just anybody, because you can get too much vitamin D. But if you test vitamin D and you're deficient, I always encourage testing it again in another 2 or 3 months, because you want to see how quickly it's going up, and you want to make sure you're not over supplementing. Because again, that has those detrimental effects on your bone health, on your immune health, a lot of different aspects of your health. And so with the micronutrient testing, we don't necessarily do that again. It's expensive. It really, I mean, it doesn't warrant testing it again. So that one time, you know, the deficiencies that are causing your problems, that are probably leading into your lack of energy. And we start supplementing with that. We start replenishing those levels with the IV therapy. And it's really based on how you feel. You're feeling great again. Awesome. We don't really need to test and go any further, because your symptoms are gone.
So like, let's say someone's feeling poorly and they come in, they have the micronutrient testing, they have the blood work done to see the other vitamin levels, and they start on a program. And they feel a response. Like, how quickly do people feel a response? I'm sure that changes per person depending on how bad off they were, to go. But also, is there kind of a general, like, you'll feel a difference in like a day, a week, or does it take, a couple weeks? Like, what are some answers?
Yeah, absolutely. So some people do feel better immediately, like within that first few minutes that they're starting to get their IV, and they're already at the front, they're checking out, they're like, oh man, I feel so much better already. And it's really great to hear that. That's probably because they were really dehydrated, and with our IV infusions, you're getting hydration as well. I always kind of equate it to when your dog isn't feeling well, you take it to the vet and they give it fluids. It's the same thing with humans. Like, dehydration has such a huge effect on our overall well-being, our mental health, our physical health, how we perform. So hydration alone, and that hydration is immediate. A lot of people will feel that really quickly. With the people that are deficient in nutrients, and we start to give them those nutrients back, it can go either way. So either they're really depleted and it takes a few IVs to really kick in and start doing the magic, or they feel better immediately because they were deficient and now they have those nutrients and now their body is working better. So everybody responds differently. And we do tell people it does take up to sometimes 2 or 3 days to really feel the maximum benefit from that. I think, and don't quote me on this, probably should say, but vitamin C, I think it takes 48 hours to get into the cell. So it's not something that you just take and you're going to pee it out. A lot of people have that misconception. It's in your body, it's getting absorbed, it's a nutrient. It's not going to turn things on or off. It's going to upregulate and help those metabolic pathways in the way that your body needs that help right now. So it could take a couple days to feel the effect, but a lot of people do also feel it immediately.
Okay. And how long does it take to do an IV nutrition therapy treatment? Is it about the same for everyone, or is it different? Because I know you have a different nutrient bag for people, or I don't know if there's different sizes. So.
There are different sizes and everybody responds differently. Okay. So I can put the same exact bag up. A lot of couples will come in and girlfriends on their Friday night kind of thing, and they'll all get the same bag, and not everybody finishes at the same time. It's really dependent on, one, the catheter size that we use, which we try and not use something that's too small. It's going to take too long, but we're also all about comfort, and we're not going to use anything too big to just slam it into the body, because that's not good either. So that being said, we have quarter liters, half liters, and full liter bags, and it takes 15 minutes to 30 minutes to 45 minutes for each bag.
Okay, wonderful. Now, something else which we've talked about before that I found was fascinating is there are certain medications out there that we take for other health conditions that actually inhibit or hurt some of the absorption of some vitamins. Like, what are some common ones that there's an interaction and it's kind of, doesn't help the situation?
Yeah, absolutely. There are a lot of common medications out there that do cause nutrient depletion, and not everybody's aware of that. So some of the most common ones would be acid reducing medications, over-the-counter PPIs, omeprazole, things like that. That actually decreases your stomach acid, and stomach acid is necessary for B12 absorption. So if you're taking a PPI, you might not be getting your B12 from your food or your supplement. So that's one. And again, being over the counter, you're not necessarily talking to a doctor about that and having that monitored and regulated. So that's one that's really common. The other one is oral birth control pills deplete your B vitamins, B6 specifically, and then a lot of your minerals, so magnesium, zinc, selenium, things like that. So even just oral birth control, which is monitored by physicians, but don't necessarily monitor your nutrient status. So taking a multivitamin is usually recommended. That's a common thing that I see, taking a multivitamin with that, but also having some IV, just B12 injections. So that's the other thing that we do there. It's not just IVs, it's also injections. So we have B12 injections, we have B complex injections, which encompasses a lot of your B vitamins and a lot of different things that we can do without having to sit there and get an IV. And that kind of just takes the place of oral supplementation for a lot of people. They can't keep track of taking a capsule every day. And so coming in once a week for a shot is a lot more feasible for them and helps them stay on track. One other medication that is commonly depleting your B12 can be metformin, is also implicated in that in some instances. So a lot of people are on those medications, but not everybody is paying attention to their nutrition status.
A lot of people don't even know about it. I have to admit that this is something new. I'm not on those medications, but those are things that I don't hear in general medical practice, and it's quite vital, especially a lot of young women who are on birth control. That's huge to know. And I know there's a lot of women that complain of fatigue and stuff, and the changes in what birth control does. It's really important to know that it does affect your B vitamins.
Absolutely.
Now, when people are plant-based, they have to supplement with B vitamins. Is doing an injection any better than a pill form when you're comparing the two?
Yeah. So again, going back to kind of that tier, I guess I could squeeze in intramuscular injections between oral supplementation and IVs. So intramuscular injections are going into the muscle instead of the vein. So it's going to be a slower absorption, but again, it's not dependent on your gut health. So it is kind of takes that step above oral supplementation. And oral supplementation is recommended really commonly or frequently with some of those medications, depending on your practitioner. But again, if you're not absorbing it right, if you are taking omeprazole or some kind of acid reducing acid blocker, then you're not going to be absorbing those oral supplementation nutrients.
Gotcha. And then are there other things besides B vitamins that you recommend for people who are vegan or plant-based? Is there any other micronutrients or anything else that you recommend?
Yeah, absolutely. So one of my favorite things is I love talking about aesthetics and skin health in general. I love collagen, and collagen is actually a majority of proline and glycine, two amino acids. Vitamin C is also really pro-collagen, pro-tissue. So it really helps with wound healing and the appearance of your skin. It can even help with fine lines and wrinkles when used in combination orally and topically, things like that. But one downfall of vegan is there's really no source of collagen. So you have to take those peptides and the amino acids that build into that on your own. So IV therapy can actually deliver high amounts of glycine and proline specifically, as well as vitamin C. So it's not the same thing as collagen, because we're not just we're not putting collagen into veins, but it really does help supplement, and having that alternative is really something that has helped a lot of people. Especially with, I'm just thinking about we have different names for our bags, like Bountiful Beauty and Repair and Rebuild. Those are really high concentrations of amino acids in those bags. And I have so many people saying after even just one, but after like 2 or 3 bags, like my hair is growing back. My clients are telling me that my skin is glowing, and the only thing I've changed is getting these amino acids. So it really does have a huge impact on your appearance as well as your internal health. It's feeling good on the inside and out.
Yeah. Now, there are some foods that are kind of known to have supposedly all amino acids, like quinoa or hemp seeds. Do they have the correct amino acids for building the building blocks of collagen?
Yeah, so I'm not 100%. I didn't brush up on any of my amino acid profiles on those.
Yeah.
But I do know, so when we're talking about vegetarianism versus animal sources of protein, that you can have a complete protein or an like having all of your essential amino acids in one meal. There's no single vegetarian source of getting all of your essential amino acids. So that's why you see those pairings, rice and beans. Together, those have a complete profile. I think it's peanut butter and wheat or the fortified bread together that gives you all of your amino acids that you need, the essential ones that we can't make in our body on our own.
Okay, wonderful. And then also just to touch on anti-aging a little bit more. So vitamin C is kind of the big one for that, correct? Are there other ones that are important, or is vitamin C really the one that helps with the collagen and
So I'd say all of the nutrients are helping with anti-aging because they all work synergistically. They're working to upregulate the pathways in your body that lead to increased energy production, DNA repair. That kind of leads into, we just actually started offering NAD IV therapy, and NAD is nicotinamide adenine dinucleotide, and it's something that your body produces naturally through the Krebs cycle, and then it goes into the electron transport chain. There's a lot of biochemistry around it, but so your body produces this naturally, and it declines with age. And what this is so important for is that DNA repair, for providing your electron transport chain to make your energy, for so many different things that is now really big in the anti-aging community. And we've had a lot of really great responses to our NAD therapy. So that would probably be top of the line, like your number one anti-aging IV right now, but we always recommend doing that in conjunction with your B vitamins. So that NAD is actually a derivative of niacin, your vitamin B3. So supplementing with those cofactors just enhances the response that your body has and increases just all of it. Tryptophan is actually really good for converting into NAD as well. So again, we add tryptophan to those bags specifically. There's all these cofactors. Everything plays synergistically. Everything goes into that bigger picture, what you're trying to get out of your IV.
Wonderful. And if you're doing this NAD IV bag, does it matter? Do you keep it for certain age groups? Is it for people of all ages, adults on up? Is there an age range?
Yeah. So, I mean, I wouldn't put myself in like the older adult population. So even I've done it and I've benefited from it, and I really enjoyed the thing with NAD is it helps normalize over the long term. So I am a coffee fanatic. Medical school did that to me, and I would be drinking 3 shots of espresso a day like it's nothing. Since I had the NAD, the day after, it was so funny. I tried to drink my coffee, and usually I slam that down in the morning. I ended up taking it to work with me, like in my drive to work, and still hadn't finished it. And I got to the parking lot to go into work. I'm like, dang, I didn't finish my coffee. That's so weird. And I never leave coffee. Like, that is my one thing. I hate to leave coffee in my cup. Like, I have to drink it. And again, later and I didn't think anything of it at that time until later that day, I went for my second cup of coffee. It just did not sit right with me. I'm like, I'm getting really hyper from this, that I never had that response before. So it actually helps normalize that energy for me and optimize my energy so that I don't need that second cup of coffee. And now I know what people mean when they get jitters from coffee, because I had that baseline of energy that was given to me the day prior. Age, that's what we're talking about, age range. So there's really no limitation who gets it, other than at IV Nutrition specifically, we do not treat or give IVs to people that are 15 or younger or 100 pounds or younger. So you do have to be a certain age to get that. Just because below that, when you have a really small person and you're putting a lot of fluid in, that can do a lot more damage than somebody that's bigger and can handle that amount of fluid. Also, that being said, as far as safety guidelines that we follow, we take vitals, we monitor blood pressure on everybody, we take everybody's temperature, we take pulse and oxygen saturation, making sure that you are coming into this in not in distress, essentially.
Right.
But we also, if somebody gets a 1 liter bag or really anything over 600 mils, we're checking urine because your kidneys are filtering all of this. And if you already have kidney damage, this can just exacerbate it. It's not that it's causing kidney damage. It's just going to exacerbate something that's already there. And most of the time, it's really not that big of a deal or a problem. But every once in a while, you catch somebody, you're like, did you know you should probably go see your doctor about this? So it's not 100% for everybody, but we do make sure that we take all those precautions, and we are more clinically based and clinical thinking in that clinic than a lot of other party IV places. So we do really take that very seriously.
So someone who has kidney disease, can they still come in, and do you just maybe titrate it at a slower rate into their body, or how are there accommodations for that kidney disease?
So if there's a pre-existing condition, because we're not creating a doctor-patient relationship necessarily, we always like to have that nephrologist or that doctor, whoever's in charge, on board with it. If they have a pre-existing known kidney issue, absolutely, we would have them just have your doctor fax us over a note saying that they're okay with you getting this.
Okay.
There's a lot of other conditions that it's totally safe with, but if it's not a contraindication, but they do have something going on, we'll always drip slower. We'll always monitor, take blood pressure every 15 minutes during the drip, things like that. Because again, safety is absolutely number one.
Yeah, and I can imagine you work with a lot of diabetics, right? To help them as well to get the nutrition in, especially if they're taking metformin and there's some kind of blockage in absorption of the nutrients.
Yeah, definitely. And it's not just about the nutrient. I mean, that's incredibly important, but if you have diabetes, if you're diabetic, you have a lot of inflammation in your body. And the vitamin C, all these nutrients, hydration is all very anti-inflammatory. So it helps people in that way as well.
Yeah, it seems like a lot of conditions, we're hearing about that more, how inflammation seems to be the marker of so many chronic diseases out there. I mean, stress, increased inflammation, and then you have just the resulting diseases and conditions because of inflammation. And it's great to hear different ways of reducing inflammation, and especially if the IV nutrition, that helps as well. I mean, it's another tool people have to be able to combat any inflammation in their body.
Absolutely. And I wish you could see it. I'm not there right now, but I wish you could see it, and I could give you a little tour maybe next time. But we have this really great, I measured it once, it was almost 15 feet Himalayan salt wall. So we actually have blocks of Himalayan salt in there, and it's we really go for that relaxing spa setting. So there's actually 2 sides to the room. So we have 2 of those walls. Everybody has their own chair. It's like a massage chair, but it's like the movie theater seats that recline. So it's really comfortable. Everybody gets a hot pack, a blanket. You have curtains so you don't have to see your neighbor. And it's just really relaxing, and everybody falls asleep in there. They wake up so refreshed, and just getting that time to relax and think about nothing else other than yourself in that moment is so therapeutic, in addition to the nutrients that we're giving you. But just that 15 to 30 minutes that most people are there for is just so rejuvenating for them.
It sounds amazing. It sounds wonderful. And
it is.
Yeah, I bet. Is there anything else that, I mean, we covered a ton of topics. Is there anything else related to vitamins or nutrients that you can think of that we didn't cover that could benefit people?
Yeah.
We're really going through.
Can you hear me?
Yes, I can hear you.
Okay, sorry. I just got the tone of death of my right AirPod, so I just want to make sure I'm still on. So I'm working out of my left AirPod right now. So there's so many benefits to IV therapy that, again, like we talked about, just go above and beyond. It's not just that you're eating right and you're getting all your nutrients. Like, that's great, but not everybody's functioning optimally. You're not getting to those optimal levels, I guess, is the bigger picture. So we really focus on optimizing health, optimizing performance, mental health, anxiety, things like that, as well as athletic performance, as well as that's the other really big thing actually in Arizona is a lot of people like to visit because we're nice, sunny, and it's really nice to hang out by the pool in the summer. A lot of people out of town will get dehydrated within a day because they're just not used to drinking so much water. It's a dry heat, so it doesn't feel as intense, but it's intense. So just hydration alone, we have what we call hydration happy hour, because we want to have people come in regularly to help with their hydration. Most people don't drink enough water. Most people don't even like drinking water. So just giving everybody those tools and opportunities to come in and get hydrated every week or even twice a week.
That's great. It's almost like you have a little community, and I'm sure you get to know them pretty well. And wonderful. That's great.
We really have great clients there. Everybody's really great, and all of the frequent visitors. It is that we kind of talk about. I was almost going to adopt a puppy at one point a week ago, and I had one guest that kept coming in. She's like, "Did you get the puppy?" "No, not today." "Next time." "Did you get the puppy?" And she was so invested. So we really do get invested in each other's lives, and it is a relationship that we build with our guests.
Well, it's nice because once you get to know someone and you know kind of like their general personality, then as soon as something shifts and they become ill or something, you can sense that change. And that's one of the things that I really value with healthcare when you have that relationship is you're getting to know the whole person. That's why one reason I like naturopathic medicine is you're treating the whole person, you're addressing all of them. And so as you're getting to know them, you get a vibe of what their energy levels are, how they tick, their interest. And then as soon as something starts to shift, you can mention it to them and, how are you feeling? Or maybe we should take a look at something. You're able to address all of that, which is really helpful.
Absolutely. And that's how we start each visit, is going back into the consult room. What's going on today? Do you want what you've been getting? Do you like that? Is it working? Do we need to shift and change up some of these nutrients, some of these concentrations? Do you need more immune support today? Are you starting to get the sniffles and feel a little down? Or are you just so fatigued you need a boost of energy? So we do switch it up as needed, but really honing in on that, exactly like you said, just knowing the person and knowing what they need that day.
That's wonderful. Well, if anyone wants to learn more, we have your website for where you're a clinical director, the ivnutritionnow.com. So they can learn more about the IV therapy there, all the different options through that website, or they can also even have a personal consultation with you, contact you through the info at Victus Integrative, where you do see people one-on-one in that physician-patient relationship and help them on their journey to health.
Right, absolutely. Yes, if you need an IV, go to IV Nutrition. And then if you'd like to know more about just optimizing your health, hormone, any sort of lab work, things like that you're interested in, I would encourage you to go to Victus and email that info at Victus.
That's wonderful. Well, we really appreciate having you on, and thank you for taking some time before your busy workday. And it's great for all of us to learn so much more and how we can improve our health. I know it's vital. And now that there's a lot of introspection on how we can improve our health, these conversations are really vital and relevant. And just taking the time to do this with us, we really appreciate it.
Thank you, Dr. Amy. I appreciate being on here. It was fun.
Wonderful. Thank you guys all for joining us, and we will see you next week for more information on our wellness hour, and have a wonderful week. We'll see you later. Bye.